All right, good day, everyone. Welcome again to biology class. I believe you are well. So, for today, we're going to look at a topic titled Sexually Transmitted Infections. Sexually Transmitted Infections. And the topics we're going to look in the subtopic we're going to look in this topic is we're going to look at the definition. All right, so we're going to look at mode of transmission of these sexually transmitted infections. Look at the symptoms, preventions, control, and look at HIV and AIDS in this topic. Alright, if you're ready, let's dive in. Now, the objective of this lesson is that by the end of this video, learners should be able to, number one, define STI, which is sexually transmitted infections, mention some examples of STI, mention ways of transmission of STI, mention symptoms and prevention of some STI, and explain how HIV AIDS spread over the body. So these are the objectives every learner should be able to give back after this video. When you watch this video, these are the objectives you need to give back to your teacher after this class. Alright, let's move on. Let's look at the definition of STI. Now, mind you, STI stands for sexually transmitted infections, and it's a venereal disease, which means it spreads easily, and they are diseases that are contagious through sexual intercourse. So sexually transmitted infections are diseases that are contacted through what? Sexual intercourse. For example, we have the syphilis. Examples, we have the gonorrhea, we have the herpes, we have the thrush, we have the AIDS, and so on and so forth. So that's the definition of STI infection. So they are just diseases that has been transmitted through sexual intercourse, mostly with an infected person.
Gonorrhea is a common type of sexually transmitted disease or infection. It's sometimes referred to by the slang term, the clap. The germs that cause the infection are tiny bacteria called Neisseria gonorrhoeae. You can catch gonorrhea from an infected person during vaginal, anal, or oral sex. And if a pregnant woman has gonorrhea, she can pass it to her baby as the baby moves through the birth canal during childbirth. In your body, the infection begins when the bacteria attach to cells in the tissue that lines many of your body cavities, called mucosal epithelium. Once attached, the bacteria begin to invade this tissue. As the bacteria multiply over time and damage your cells, they cause immune cells to enter the tissue. This inflames and damages the tissue as your immune cells try to clear the infection. Unfortunately, the bacteria have ways to avoid being eliminated by your immune cells. This allows the bacteria to grow and spread within your body. The main risk for getting gonorrhea is having oral, anal, or vaginal sex with a person who's infected. You may have a higher risk if you're sexually active and have more than one sex partner, are a teenager or young adult, or are a man who has sex with men. Many people have no symptoms, but if a woman has symptoms, they may include an abnormal discharge from the vagina, vaginal bleeding between periods, and a burning feeling while urinating. A man may have similar symptoms, such as an abnormal discharge from the penis, a burning feeling at the tip of the penis or while urinating, and pain in one or both testicles. In both men and women, gonorrhea may also infect the rectum, which is the last part of the large intestine. Symptoms of infection in the rectum may include itching or abnormal discharge from the anus, and pain during bowel movements. Left untreated, the infection may cause pelvic inflammatory disease in women. This means the infection has spread throughout her reproductive organs. In men, it may lead to epididymitis. This refers to inflammation and swelling of the coiled tube attached to the testicles, called the epididymis. The good news is that gonorrhea can be treated successfully with antibiotics, such as ceftriaxone. You may also be prescribed a second antibiotic, such as doxycycline, to treat possible infection with another sexually transmitted disease called chlamydia. People who have gonorrhea are often infected with chlamydia at the same time. It's important to know that treatment may not fix any damage the disease has already done to your body. After treatment, it's important to follow up with your doctor to confirm the infection has cleared, because some bacteria have become resistant to antibiotics. You can reduce your risk of getting gonorrhea if you only have sex with one long-term partner who doesn't have sex with other people and who has been tested for gonorrhea and doesn't have it. And you can practice safer sex, which means taking steps before and during sex to prevent you from getting or spreading gonorrhea. For example, using condoms correctly every time you have sex can reduce your risk. The most reliable way to avoid getting gonorrhea is to practice abstinence, which means not having vaginal, anal, or oral sex. To find out more about gonorrhea, talk to your healthcare practitioner.
Let's look at the first example we have here, gonorrhea. Now, gonorrhea, all right, the causative organism of gonorrhea is a bacteria called Neisseria gonorrhoeae. Neisseria gonorrhoeae. This organism is the one responsible for the effect or the cause of gonorrhea. Let's look at the symptoms of gonorrhea. Number one with gonorrhea, we have a burning sensation during urination. That is in male. When don't urinate, they feel this kind of pain, this kind of burning sensation, mostly in their private parts when they're urinating. Number two, there's a yellowish discharge in the male, right from their private parts. There's a yellowish discharge in the male. And number three symptom is that there's pain on passing urine in females. So one with gonorrhea infection will experience pain when urinating. Number four, vaginal discharge and swelling of the vulva. So there'll be vaginal discharge, some discharge like some semen or like liquid coming out from the vagina, and the vulva, which is the external part of the female reproductive system, will start to swell. Number five is redness around urinary opening. So redness around urinary opening, that means your organ for you used to urinate, there'll be kind of redness around there. These are signs of symptoms of what one who is infected with what gonorrhea, and they will have what we call sterility at advanced stage. Now, this sterility simply means they will not be able to reproduce. Once this gonorrhea is not treated, it could lead to the inability to reproduce young ones. So it could damage the reproductive system of the male or the female. Now let's look at prevention/control. Number one is to discourage commercialized prostitution. To discourage commercialized prostitution. So those people that we call them sex worker, those people that offer their body for sex in an exchange of money, such practice should be what? Discouraged. Then number two, avoid multiple sexual partners. Avoid multiple sexual partners. Then number three, get medical attention and stop sexual intercourse with previous partner or partners, because it's better you stick with your wife or with your husband. But one who is flirting around with other spouse or sleeping around with other people, you can easily contact this particular disease. So one way to prevent it is to avoid multiple sexual partners, stick with your partner, or to get medical attention and stop sexual intercourse with various partners or a particular partner that you are having sexual intercourse with. These are the ways to control and prevent gonorrhea. Number 2 we have is the syphilis. Now, the syphilis is a causative organism. The causative organism for syphilis is a bacterium known as Treponema pallidum. Treponema pallidum. This is the organism that causes syphilis. It's a bacteria, or it's a bacterium, which is one. If it's more than one, it's called bacteria. So the bacterium that is responsible for syphilis is called Treponema pallidum. So this is responsible for syphilis. And let's look at the symptoms. Now, one of the symptoms here is that a small painless sore appear on the penis, that is for the male, or vulva of the female as the initial stage. A small painless sore appears on the penis for the male or vulva for the female as the initial stage. The number 2 symptom is fever, skin rashes, mouth ulcer, aching pains at the lymph nodes at secondary stage. So there will be fever, skin rashes, mouth ulcer, then aching pain from that sore at the secondary stage. When this is moving to the next stage, the person begin to experience pain. That sore that appear as if it's painless, begin to experience pain on that sore, alongside with other of these symptoms I'm taking here. The number 3, we experience what we call nervous disorder, insanity, repeated abortion. Now, when we say nervous disorder, it means your nervous system will start having issues. Alright, and someone, if it's not well treated, it can lead to what? Insanity. That's losing of your senses most of the time, and can lead to what we call repeated abortion. But let's look at ways to prevent or control them. The ways to prevent and control syphilis is the same way you control your gonorrhea, which is discourage commercial sex, discourage commercialized prostitution, avoid multiple sexual partners, then get medical attention or stop intercourse with your previous partner or partners. So the same way you apply prevention to gonorrhea, the same way you apply it to syphilis. Let's look at the third one. This third STI disease is called
HIV is the human immunodeficiency virus. If you have HIV, you have an infection that damages your immune system over time and causes AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. It is the final stage of an HIV infection when your immune system is damaged and too weak to fight off ordinary infections. When foreign invaders, such as bacteria and viruses, get into your body, they can cause infections. These events activate your body's defenses. The white blood cells of your immune system are part of your body's defenses. One type of white blood cell, called helper T lymphocytes, or helper T cells, strengthen your immune system's response to infection in 2 ways. First, helper T cells release chemicals that attract other white blood cells to the site of the infection. These additional white blood cells attack the invading bacteria or virus, as well as other infected cells. Second, helper T cells release chemicals that cause other white blood cells to multiply. These new white blood cells create markers, called antibodies, which can identify the same foreign invader throughout your body. Antibodies attach to the bacteria or virus, marking them as targets for your immune system to destroy them. If you have HIV, it travels through your blood and other body fluids to infect and kill certain white blood cells. The virus enters helper T cells, which are the primary target. Once inside, the virus makes many copies of itself. As these virus particles are made, they leave the damaged helper T cell to infect other cells. The T cell loses its ability to protect the body from the ongoing infection and dies. In this way, HIV spreads and kills more of your helper T cells, weakening your immune system. As a result, other types of infections are able to take advantage of your body's inability to defend itself. These infections are called opportunistic infections. If you have an HIV infection and one or more opportunistic infections, you have AIDS. Some of the common AIDS-related opportunistic infections are inflammation of the tissues covering your brain and spinal cord, called meningitis, inflammation of your brain, called encephalitis, respiratory illnesses, such as pneumonia and tuberculosis, intestinal illnesses, such as chronic diarrhea caused by infectious parasites, and cancers, such as Kaposi's sarcoma and non-Hodgkin lymphoma. HIV passes from person to person through infected body fluids. HIV can enter your body during unprotected sex, while sharing drug injection needles, during your own childbirth, while breastfeeding from your mother, or from contaminated blood or blood products. Although there is no cure for HIV, drugs called antiretroviral medications can reduce the amount of HIV in your body. One class of antiretroviral medication, called entry or fusion inhibitors, disrupts the HIV infection process by preventing the virus from attaching to your cells. Other classes of antiretroviral medications include reverse transcriptase inhibitors, protease inhibitors, and integrase inhibitors. These drugs prevent the creation, assembly, and spread of new viruses. Your doctor may prescribe a combination of these drug classes known as highly active antiretroviral therapy, or HAART. Antiretroviral medication doesn't completely remove HIV from your body, but slows it down enough to enable your immune system to fight infections. Regular blood tests will let your doctor know how effective your antiretroviral medication is in controlling HIV. If the number of helper T cells is high enough in your blood sample, your medication is working. Treatments for the opportunistic infections of AIDS are medications specific for each type of infection. For example, your doctor may prescribe antibiotics if you have pneumonia or tuberculosis. To avoid getting or spreading an HIV infection, know your HIV status and your partner's status by getting tested regularly. The most effective way to prevent HIV infection is to avoid vaginal and anal sex. When engaging in sexual activity, you will be less likely to contract HIV if you only have sex with one uninfected partner or use latex condoms for protection. Avoid using injectable illegal drugs or sharing drug needles because the needles may have the virus on them. Avoid intoxication from drugs or alcohol because you will be more likely to engage in unsafe sexual behavior.
Acquired immune deficiency syndrome, which is the acronym for what? For AIDS. Now, the causative organism for AIDS is the human immunodeficiency virus, which is the HIV. The HIV is the organism responsible for causing AIDS. AIDS is the sickness or the diseases. But what causes the AIDS? The organism that causes the AIDS is called human immunodeficiency virus, which is the HIV. Let's look at the symptoms of an HIV patient. One of the symptoms is there will be fever and chronic diarrhea, where you begin to lose water from your body, excessive weight loss, general skin irritation, swelling of the gland, persistent cough, persistent severe fatigue. That means you get tired easily, the person begin to cough unnecessarily, most of the glands begin to swell. Now let's look at a way to prevent this particular deadly disease. Number one, keep one faithful partner. That means avoid having more than one partner. That is one way to minimize or to control HIV. Then number two, avoid sharing sharp objects such as razor blade, clipper, and so on and so forth. Number three, screening of blood before transfusion. The blood that we transfuse into patients, maybe in the hospital, must be screened properly before it is transfused into any patient. Number four, avoid oral, anal sex, and kissing. Avoiding oral, anal sex, and kissing is one way to prevent the spread of what? HIV, or the spread of the AIDS disease himself. The number five is national mass campaign to educate people on the danger of HIV. So this one way is to prevent the spread of what HIV is to what? To campaign to educate the public and make them to be aware of this particular disease. These are ways to control HIV and AIDS. Alright, let's look at the next sexually transmitted infection is called the genital warts. And the genital warts, the causative organism for genital warts is the human papillomavirus. It's known as the human papillomavirus. And one of these is that the symptoms is that you feel a painless flesh color bumps, or you call it warts, which develop on the penis for the male or in around the vagina and the anus of the female, and may reappear at different times. And also, one of the symptoms is that you have what called cervical cancer. It has to do with the female cervical cancer. And the ways to prevent this is, number one, is to vaccinate women that are between the age of 9 to 6. Avoid sharing items including towels, razor blades, bars of soap, footwear, and other objects. So these are ways to control genital warts. Now let's talk about the HIV and the AIDS. Now the HIV, which we all know as acquired immune deficiency virus, now is a pathogen that causes what? AIDS. So the HIV himself causes the what? Disease called what? AIDS. And one way this disease is spread or being transmitted is through what? Majorly is through sexual intercourse. Now, AIDS is a disease in which the human immune system is completely broken down. Alright? It's completely broken down. This particular disease affects the human immune system, and the immune system is one responsible for protecting the body against foreign objects of diseases that enters into the body. So what the AIDS does is that it goes to attack your immune system, which is made up of the white blood cells. And once it attacks it and breaks it down, it will render your body to be unable to fight any sicknesses that come into your body. And HIV belongs to a group of what we call the RNA virus, which is referred to as what? Retroviruses. So they're also capable of converting their RNA to DNA, which means they can change their dynamics in a way to what? To attack and destroy your white blood cells, which we call the T cells, or we call it what? CD4, or you call it what? Lymphocytes. Lymphocytes are the one responsible for fighting diseases, engulfing diseases in your body, or you call it what? The T cells. These T cells are they made up your immune system. They fight against dangerous diseases that comes into your system. So this is what the HIV goes for. It goes to destroy your T cells or your immune system so that your body will not be able to fight against any diseases. So it render your body open for any infection to take place. Now, HIV can remain dormant in the cell of the host because it takes a lot of time. It takes years before it can actually destroy all your immune system. It might take years. So it remains dominant in the cell of the host for years. And then that years, it keep on multiplying, right? Until this virus destroys all the hepatic cells in your body. So it takes time, it can take years before it can destroy all the hepatic cells in the host. And once the body loses too many hepatic cells, the body defense system against infections crumbles and the body becomes vulnerable to various diseases, pathogens, which cause various opportunistic diseases. So once your immune system is destroyed, you have some diseases which we call them opportunistic diseases, which means those diseases that your body can fight naturally, like cough, malaria, and all such diseases. They will not have the opportunity to now come in and begin to destroy the body because the hepatic cells has been destroyed by the HIV virus. Let's look at mode of transmission of this particular disease, HIV virus. Now, apart from sexual intercourse, which we know, as we said earlier, HIV can be transmitted through the following. Number one, through receiving blood transfusion from an infected person. So that's why the blood that is being transfused, mostly in the hospital, maybe someone is in need of blood and they want to transfuse blood into that person. The blood must be screened to check for this particular virus. If not, the blood which is transfused that contains HIV virus can be sent into someone that doesn't have that virus before. So one way you can transfer HIV is through what? Blood transfusion. Number two, through infection from pregnancy, all right, from the mother, or through infection through pregnancy, that is through childbirth and breastfeeding. So it can be passed from a infected mother to a baby in the womb. Number three is using infected needles and syringe. If your needles are not treated, if your syringe are not properly treated, or if they use that syringe for someone that is already having HIV virus and they use it for someone that is just clean without HIV virus, it can be transmitted through that syringe and through that needles. So thereby, needles and thread and syringe should be what? Treated before they use it for someone. Now, one way again to which this disease is being spread is by practicing oral and anal sex. Oral sex and anal sex. These are sex that is not done in a natural way. So oral sex and anal sex are another form of sex, and this can lead to what? The spread of what? HIV virus. Now, open mouth kiss with an infected person. Open mouth kiss with an infected person can also lead to the spread of what? This HIV/AIDS, because the virus is found mostly in the mucus, is found in the fluid of the infected person. So when there's an exchange of fluid with someone that doesn't have it, for sure that person is going to contact such virus. All right, let's look at some assignments we can attend to. The following diseases are caused by bacteria except dash: A. Gonorrhea, AIDS, syphilis, none of the above. The following diseases are caused by bacteria except dash. Now, gonorrhea is caused by bacteria, syphilis is caused by bacteria, HIV is caused by virus. So your answer is AIDS, HIV. Number 2, a disease characterized by high fever, loss of weight, chronic diarrhea, wasting away, and final death is dash: A. Gonorrhea, B. AIDS, C. Syphilis, D. None of the above. The answer there should be AIDS. If you look at the lesson notes, you see it there. Number 3, the which of the following is not a sexually transmitted disease, which means it's not transmitted, which means it's not transmitted through sex. For gonorrhea, is a sexually transmitted disease. AIDS, syphilis, they are all sexually transmitted disease. The only one that is not actually transmitted through sex is what? Malaria. Number 4, which of the following statement is wrong? All STI diseases are viruses. All STI diseases are caused by bacteria. All STI diseases are caused by protozoan. All of the above. Okay, which of the following statement is wrong? He said all STI diseases are caused by virus. Not all STI diseases are caused by virus. Some are caused by bacteria. All STI diseases are caused by bacteria. All STI diseases are caused by protozoa. All of the above. The answer there should be D. All of the above is a wrong statement. All of the above cannot be correct. So the answer is D. Number 5, a disease which delays symptoms which are similar to symptoms of other disease is dash. A disease which delays symptoms which are similar to the symptoms of other disease is dash. The answer there is syphilis. Answer there is syphilis. All right. So you can practice this question on your own to get more understanding. So here are some questions for you to answer. Make sure you do your workings. You make sure you answer these questions and you submit at the right time. And God bless you. See you in class. Have a nice day. Bye bye.